the most part, at least from around the studios of Radio Maria 91.3 FM, the voice of truth. We're experiencing some very light rain. Beautiful one, I would say that. And so that note, we want to warmly or coldly welcome you to another wonderful edition of Echo Care, your program on the environment. Echo Care raises awareness and promotes environmentally responsible behavior. This program encourages public participation in the management and protection of the environment. All right, today is World Health Day, and it's very apt that we're having this edition of the program. On Echo Care, we promote environmental health services and care. That is what we'll do on this program. So it's nice to have you join us on a wonderful edition. My name is Stephen Ame, the Environmental Health Officer on radio, and I'm very, very happy and excited to have you join us on another wonderful edition. Today, we're continuing our discussion on the issue of WASH. Why today's World Health Day, we'll be promoting issues of immunization, which is equally coming up and it's a part of this month. So there's a lot of celebration, a lot of commemoration in this month of April. Yeah, and I have a very important guest in the house to lead all of this discussion. I have in the house Nurse Hanifa Abdullahi, a medical practitioner with a very reputable hospital in Abuja here, coming to lead us in the discussion. It's nice to have you join us, Nurse Hanifa.
Thank you very much.
All right, happy World Health Day.
Thank you so much.
How healthy is our country, Nigeria? Abuja to start with.
We could say, let's give ourselves 80%.
80%. I mean, you can tell in your face and the smiles and all of that. Okay, happy World Health Day to everybody listening to us. Health is wealth, and that is what we promote on this program. Public health don't just start in the rooms, in the hospital room, but we start from our environment, and we're doing everything on this edition to promote all of that. All right, when we come back after the short break, it's all about World Health Day, all about WASH, and we'll be immunizing you really for free on this edition of the program. Please stay tuned and don't go away. All right, welcome back, Abuja. I'm just still tuning to 91.3 FM Radio Maria, the voice of truth. On this day, the world commemorates World Health Day. And I have the studio joining me, Nurse Hanifa Abdullahi, to have all of the discussion. Today, we have so many things to talk about. I wonder if we can do that in all about 55 or 1 hour we have on this program. All right, Nurse Hanifa, nice to have you join us on this edition of Echo Care. Welcome, seriously, to have you. Most time we have days to commemorate, but it hardly falls on the date. But today, thank God, is World Health Day, and you're here in the studio with us. Like I said, we have a lot to discuss. World Health Day, World Immunization Week, World Immunization Week, right?
Yeah.
And we're talking about all of that. So let's quickly just start with World Health Day. I mean, you're a medical practitioner. What do you have to say? I was trying to ask about how healthy our country, Nigeria, is. From practices and all that we're doing, what can you say about our standard of living health-wise? Where are we on the scale?
I could say our standard of living worldwide, if we say we want to rate ourselves honestly, we could just say 50% because it's reducing drastically every day and we need improvements. But I think when we put more effort, we get more improvement as time goes. So
what do we need to do to be differently to improve this our health standard of living health-wise?
Yes, one of
do we need more hospitals? Do we need more medical practitioners like you, or do you may need more budgets to be put into it? I don't know what the budget's about health this year, or what is so all of that.
that's in place. But I think one of the first step we need to take when it comes to our health, it starts from the grassroots, not the hospital first, not needing anybody. It starts from what do you eat, how many times do you take water in a day, what are these things you consume, how do you preserve your food, how do you get your food, do you know who is making this food, do you know the kind of water they use? So these particular things, I think if we can put them into consideration, it will go a long way in improving our health.
Yeah.
So they said health is wealth. When you don't fall sick, there is no need for you to go to the hospital. Yeah. So if you can protect yourself, maybe you look at the kind of food you eat, the processing and all. So if we can look into all these things, we'll have a long way to go.
Yeah, on this program, talking about food, we have discussed food safety, and that topic actually generated a lot of interest because of the type of food we eat and how most of them are either adulterated or contaminated and all of those things around food. So the health thing we're talking about is not just taking the pills, the drugs, and getting the diagnosis, but the environmental factors, our lifestyle.
Yes.
I mean, water, like you said, is basic. Take water, exercise, and exercise is part of this too, right? Yeah, do exercise and watch what you eat. All right. I mean, it's good to start on that note, talking about World Health Day. This year's theme for the World Health Day. What did you say? I'm trying to look together for health. Stand with science. I mean, bringing in research matters into it. But for me, I think the issue of research, all of that is fine. But the basic things you mentioned is what I think we need to promote on this edition of the program. Your environment, your lifestyle, what you eat, and all of that. All right, that's great. I mean, we'll have time to talk about the World Health Day, but quickly so that we see how we manage all of the discussions we have. As part of our promotion, making people live a healthy life, they will say that the ultimate goal of World Immunization Week is for more people and their community to be protected from vaccine preventable diseases. And when is the World Immunization Week?
World Immunization Week, I think this is...
Or we should start by asking, what is the World Immunization Week all about? I think that's the first place to start with. Okay. Pardon me.
Yeah, no problem. So World Immunization Week, it's like a day that the World Health Organization has picked to make people aware of vaccines, their importance, what they do, and why we should get all these vaccines.
Okay.
Yes. So I think one of the aim of this particular campaign is one to prevent most illness that could cause former years we've had issues of mortality, high rate of mortality and polio. So the World Health Organization came into place and sat down and created a forum and they had to come together, how do we reduce these particular diseases? That was what brought
I know there were some resistance in taking the polio vaccine at the point, and so much campaign and awareness had to go into it.
Yes, vaccines, not everybody is aware of vaccines. So and we have to campaign for people to know what vaccines is all about, because everybody reacts to medications differently. So in a particular situation where one person reacts, the person decides to tell the whole environment that this is what this vaccine did to my child. The rest of the people might not want to get the vaccine. So which is why we do campaign a lot to tell people about the vaccine and make people aware that yes, everybody could react to vaccine one way or the other, but that is not a crime. There are ways that we can reduce the side effects. Okay,
so who should be immunized or who should take vaccine ahead of this campaign or this vaccination that is to take place towards the last week of this month of April?
Vaccine is meant for everybody.
Okay.
But it's
not just children.
Not just children.
I mean, because many people have that mentality of child is being born. The routine is to take children for vaccine, 0 to 5, 0 to 6, 2, and all of that. Yes. So everybody
needs vaccine, because as we are growing, sometimes there are some things that come up, and there are vaccines. Like years back, we had vaccines that were given for Ebola. What they call it? There were vaccines that were given for this virus we had last.
What virus is that?
COVID, yes.
COVID vaccine,
yes.
Okay, yeah.
We had vaccines for COVID. And for adults, the other vaccines, you take yellow fever. When you're traveling out of the country, you take yellow fever. And there's HPV, human papilloma vaccine, recently that people take as well for women. Yeah, so most of the vaccines for children is just to prevent them for the disease that are going to come. Because, example, this particular period of time now, we know the rainy season is coming in, and then children at 0 to 5 years are more disposable to malaria. So I also even heard recently that there are vaccines being made for malaria recently as well.
Yeah, that would be great news, because we're planning a topic on this eco care. Malaria, World Malaria Day is on the 25th of April. Malaria vaccine will be a serious breakthrough. I think that has been expected by many persons. I hope that comes to play. Many persons will talk about, when we talk about malaria, let me not just go into that. Malaria issue is a big issue. So if the vaccine comes, for example, for us on this program, it will be a serious push. Everybody go and take malaria vaccine, because there's hardly anybody in the tropic or in Nigeria who will not have a bout of malaria infection to deal with.
Correct.
So everybody need to take vaccine, not just children, but like you mentioned, malaria vaccine is coming, COVID vaccine is there, and I need to take in yellow fever and every other disease.
Hepatitis B as well.
Okay.
Yes, they have hepatitis B. Children take hepatitis B vaccine. That is to prevent anybody that already anybody that is a carrier already coming close to them. It will prevent, protect the child from that virus. And as an adult, it's very, very important for you to also get hepatitis B vaccine as well.
Okay. Yes. The immunization week is coming up when, specifically?
Okay, the immunization week.
That's the World Immunization Week, that is, right? That's the World Immunization Week.
Yes, the World Immunization Week, we have it from 24th to 30th of this month.
Okay.
Yes. And it's like a global health campaign for people to be aware of the importance of immunizations.
All right. So everybody, before we talk about what you are planning to do on that, they understand there's going to be free immunization for persons to come. Really, immunizations, do people actually pay for them in hospitals and other places? Are they the ones you pay for, or are they all just free? I mean, I'm talking about not what the program you're planning now, but generally speaking, are they? Because I'm asking it because of some of the challenges which we're going to discuss, why people find it difficult to access vaccines and to be immunized. If you ask questions, or you, in the course of dealing with patients, there are persons who might have been able to overcome some disease or some infection, but because they don't have access to vaccine or not been vaccinated, they have that challenge.
So far, immunizations that I know of has been free.
Yeah.
You can just say free, because if you are getting immunized in a primary health center, 70% immunization is free.
So all the 30%, what's happening to the 30%?
30% maybe due to transportation, they had transportation of bringing it to the center.
So you have to defray the cost.
So stuff like that.
So it's not free.
It's not 100% free. Let's just say 70%.
Yeah, but the bottom line is free.
Free, yes.
I mean, for the basic one, anywhere you go, when you go, you're going to get the immunization free.
Yes.
On your part, the Trust Charitos Hospital is organizing one in Jabi very soon. So, how will you want to encourage people to be able to access this vaccine? The whole aim on this World Health Day is to make people have access, or to create the awareness, or to remind somebody listening to us right now. There are persons who may not actually take this serious, but probably after listening to this program, and there is a location where you can get a vaccine free, you should. So what will you be your response to that, to people who are listening to us? How will you want to make them come to take part in this? Is this outreach, is it part of the celebration of the World Immunization Week?
Yes, it is part of the celebration of the World Immunization Week.
Okay.
Yes. So this campaign now is just to make people, give people awareness about immunization. And we've seen a series of cases where parents decline immunization, and also to let them know that there's nothing wrong with the vaccines. If a child reacts to a vaccine, the best thing you do is to come to the hospital and lay a complaint. Yes. And most times, most of the reaction a child could get may be fever, which is something that you could just do the basic first aid. But when it doesn't reduce after that, then you can come to the hospital. Other than that, we've not seen any severe case as a reaction to vaccines. So we want people to know about vaccines, the importance, why they should get these vaccines, and the benefit, long-term benefit that it has to give to the child as well, and as the adult too.
So, okay, let's talk about it a little bit. Why do you think it is important for anybody, child or an adult, to have the vaccine, to get a shot?
The vaccine prevents diseases like measles, hepatitis B. We also talk about tetanus as well. Then it also reduces child mortality, because we've had a series of cases where there were increased rates of child mortality. But with the coming of vaccine recently, we've had a very drastic reduction in child mortality. And then we also increase quality of life, because if you're already immunized with let's make an example like hepatitis B. Yes, so hepatitis B can be gotten through sweat most times, just coming in contact with the person's sweat. So if you've already gotten the vaccine, so it's assumed that you're already immunized to that particular virus. So even if you come close to that person, there is 99.9% chances that you cannot be affected at all, even when the person carries the child. Because in most situations, you cannot tell every visitor that comes that don't touch my child, because you don't even know if the person is a carrier. But when that child is already immunized with a vaccine like hepatitis B, you know your child is already protected from whosoever is carrying the child. Yes. And we've also seen cases where polio has rendered children who are supposed to do great things, it has rendered them unable to do those things. So we are trying to prevent all those particular things from happening as well.
We had issue of was it Nigeria? I'm not sure now. Was declared polio free and we went back again?
Yes.
What was the? I want us to talk about the challenges you're having with vaccination, but what was the Nigerian case? I mean, is this something?
Yes, we could say one, the transportation to rural areas. Yes, because in like the urban area like this, it's easy for you to access the hospital. But then there are villages that find it difficult, like they have this find it difficult to get to the particular center where vaccine are being given. So cost of transportation is one, and then the preservation of the vaccines too. So most times in the villages there are no lights. So these people only come when they are able to preserve these vaccines. So when they come, the available people there, they give the vaccine. Most of the vaccine without light, they cannot last for 24 hours.
Yeah, I mean, I'm seeing a picture from what you're saying. It means for people to actually even access the vaccine, they have to come to the city center, to the township, to where you have the main hospitals or healthcare centers to get the vaccine. Why? Because of logistics that you just mentioned and difficulty. Now, we can't rule out the issue of insecurity in our country.
Exactly.
That really can affect health too.
Yes, that really can affect too as well, because of recent people were organized to go to villages to give vaccines to children. So if you are going to a thick village, there is 70% chances with
far remote village,
you will not come back with your box and all. So it's hard to get people that are willing to do all these particular things because of the insecurity.
Has there been a time where the government or organizers want to say, okay, let's have a security escort to do all of that? That is extra expenditure.
None that I've known of.
So the people in the villages or remote areas, they're left. What happens?
Not left out. People in remote areas, they do campaign most times. So when they do campaign to their area, they inform them that on a particular day like this, we are coming to give out vaccines. So for people that are aware of these vaccines and already know the importance of it, they pick a particular venue, station there, and these people come out to that particular place to get the vaccine. So they tell them within a particular period, when the vaccine comes, they are being preserved. They let them know that within this particular period, you have to be here to get this vaccine. After this time, we are done. So it also gets to them because most time people go there, even with the insecurity issues.
Okay, that's good. First, I want to thank you and commend you, your organization, for everything you're doing to organize one in Jabi.
Yeah.
I'm not trying to put you guys on the spot, but probably you're making plans for that in the nearest future. You'll be going into the remote areas.
Yes, hopefully.
With logistics and all of that.
Yes.
We'll campaign for that. I'll send some security men on your way.
No problem.
The Commissioner of Police is listening to us, so that people will get healthy.
Yes.
And I'm talking about World Health Day. All right. So Abuja, we're having. We'll talk about the details of the location where people can come. For me, the idea is this: that somebody listening to us right now who need to be vaccinated, we just snap his finger and be there on that day and just get vaccination. It's free of charge.
Yes.
For this one, it's 100%, not the 70% we talked about earlier. It's free of charge. I saw in the program. I'm very interested in that. There's a tea break.
No,
That's not part of the program.
Yes.
All right, let's take a short break, not a tea break. We'll be right back after this short break and continue the discussion on this World Health Day. Please stay tuned. So what did I see then, right?
It's part of our own agenda.
No, I will be on agenda.
That's part of our own agenda. The days we're having the free routines are on 25th and the 29th. That's Saturday and Wednesday.
Okay, so we'll just talk about the free vaccine location and when it's going to take place, time, and all of that things that you need to do there. Then continue the discussion. At that point, you open the phone line. We'll get calls today. Then talk about other things about sanitation and rest. Alright, welcome back Abuja. You're still tuning to 91.3 FM Radio Maria, the voice of truth. And the program is Echo Care. And I'm your dear presenter, Stephen. I'm your environmental health officer on radio. And we're talking about immunization week on this World Health Day. For many of you who have not been able to get access to immunization, one is coming your way very, very soon. And I have in the studio Nurse Hanifa Abdullahi to share more insights on this medical outreach. Vaccination is very important. There are so many vaccine preventable diseases that we can take care of by just taking a walk or taking an Uber or taking a taxi or keke and get to Jabi. Let me have Nurse Hanifa give us the details of all of that. So, as part of World Immunization Week 2026, what is happening in Jabi?
Okay, as part of World Immunization Week, as part of making like campaigning and make people know about this particular week, we have 2 very days that we've picked to do a very important campaign for this program.
All right.
So we'll be giving out free vaccines for those days. And the first day will be on the 25th, which is a Saturday, the 25th, on 25th of April. There will be free routine vaccines. And then
and like I said earlier, that is World Malaria Day. But you're not coming with malaria vaccine yet on that day.
No, we are not coming with malaria vaccine.
We pray next edition of the program you will come with one.
Yes, hopefully. We'll make it available. Yes, and on 29th as well, which is on a Wednesday, we'll also be giving out free vaccines. So if you cannot meet up with the Saturday, you should be able to meet up with the Wednesday.
Wednesday.
Yes.
Wednesday is what date?
29th April.
So 25th and 29th.
Yes.
Okay, free vaccine. Location?
The Trust Charitos Hospital.
Alright. Alright, the number to call is 081-084-47518. 081-084-47518 is the number to call to be part of the program Echo Care on this World Health Day. You can have a chance to talk about our health situation, our immunization we're talking about, and what we can really do to improve our well-being in this part of the world. We have highlighted, or we're trying to highlight some of the challenges with people have accessing a vaccine in this part of the world. Are there other challenges you think people can still highlight when it comes to not getting access to the vaccine? I mean, I just think about basic thing for me. Sometimes people don't get access because it's not the proximity, you're not close to them, and all of that.
Okay, apart from the proximity, I think poor knowledge of the vaccines. Yes, there are people that do not really have idea about what these vaccines are. Yes, they get to know about it from what people say about it, like what my neighbor know about it. When you get to hear this information, most times they don't need to find out, because whatever the neighbor says is correct. Yeah, so poor knowledge
and the neighbor's experience.
Also affects vaccination as well. Yes. Yeah. So, and I could say poor access to health to the facility. Yeah. If you most of them cannot get the location to get this vaccine is very far. So when you look at the location, you just feel like I can't do this. Imagine walking 4 kilometers to a place where you can get vaccine. Yeah. Yeah. So most times that's why we encourage people when they do campaign to go into the environment. So if you go into the villages, you go through the right channel, informing the people, letting them know that okay, this vaccine you can get it, do it this way, come out, let's meet at this particular place. When you are coming at first, we are not just giving them this vaccine directly. Now they've already gotten the info before you're coming, because you've already given the intro, like you've made talked about the awareness about the vaccine for a very long time. Like let's say you give them the awareness today, 3 days time you are coming to give the vaccine. So the information is still fresh with them. They've heard about this vaccine, they know what it do. So when you say you are coming, they are ready to get the vaccine. But if you just come into a community without informing these people, nobody wants to come and say, okay, let me get this because I want to do trial and error. You have to be very sure of what you're getting. Yeah. So I think information too as well, and then access to the vaccine.
On this occasion, what are the vaccines we're looking at getting for what particular illness, disease you want to call them?
For this particular
25th and 29th.
Okay, we have BCG vaccine. We'll also be giving
what is the BCG?
Bacillus calmette-guerin.
Yes. Let's spell that name.
And we're also giving oral polio vaccine. These ones are for children.
Okay.
Yes, oral polio vaccine, the inactivated polio vaccine. But the one adults can get, we have the hepatitis B vaccine. So the adults are not left out. Yeah. You get hepatitis B vaccine. You also get yellow fever vaccine.
Okay.
But most of the campaign, and you can also get albendazole too, which is for the deworming.
Okay.
Yes. So people don't really take that particular medications very well.
Why?
I know of Nigerians that have stayed more than 3 months without even taking deworming medicine, not even once.
So you can get all of that free?
Yes. So vitamin A as well. Most of the vaccines here are for children.
Okay.
Yes, but there are some that adults can also get, like the vitamin A, the hepatitis B, and the albendazole. Adults can also get those ones.
All right. Okay. It's still the World Health Day, and we're talking about World Immunization Week, which is coming up from the 2518 081 084 47518. All right. I just quickly want us to, before we come back to the immunization and the World Health Day thing, talk about we've started this campaign of trying to the hospital environment, promoting sanitation, promoting hygiene among healthcare givers and even the patients and all of that. Is a campaign we want to continue, especially in this month of April, to all of those discussions. What has been your experience, the state of our healthcare facilities? Okay, probably you're coming from an healthcare facility where everything is looking just fine, but I know there needs for improvement. People go to the hospitals and get infections in most cases, or when healthcare givers are interacting or engaging patients, diseases, infections take place. What can we do in this regard? Let's start with, or whatever how you want to go about it. Probably what the patients need to do what the healthcare facility need to do to enhance health.
Okay.
Because like for us, we want to emphasize the issue of health is not just about taking the drugs, doing the diagnosis and the surgery and the vaccine too, but the our environment matters a lot. It matters.
Yes. In nursing, we said we heal with the environment so as well.
Okay.
So when your environment is neat and when you are refreshed from the environment, your healing is quick. Yes. That's why most times when you're in the hospital, during the day we encourage you open the curtain so that fresh air could come in. So that most times
so that the place not get stuffy.
It doesn't get stuffy. You can heal from the environment. So one of these challenge we have, one of the way we can curb these challenges in the hospital, we can talk about campaigning and letting the hospital know how to improve waste management. Yes, like in most of the hospitals you go to, the hospitals that are not really developed, you realize that they have poor waste management. Most of these hospitals just have a particular waste bin, they dump all their waste in, which is not very good. There's a situation in hospitals that already know about management, waste management. There are different bin in which you drop segregation. Yeah, so to make it easy, and also the disposal of needles and sharps as well. Yes, if you get to places where awareness are very good, you realize that they have a particular box where sharps are being deposited. So in situations like this, if as a nurse you are protecting yourself as well, and you're also protecting your colleague as well, because if you are not doing the cleaning, somebody else is doing it. So while you are trying to protect yourself, protecting your patients, you're also trying to protect yourself as well.
Yeah.
Because most times the way you segregate your waste products, it helps in easy way to dispose them, and also training of staffs too. It's not all about letting your staff know, okay, this is how you dispose your waste products. No, you have to train them. You bring in somebody to train these people on proper disposal practices. Yes, this particular stuff, how do I dispose them? When you put these people through, you easily prevent them, protect them from getting any of these diseases, and by protecting them, you're also protecting the patients as well.
Yeah.
Yes, and we also advise use of safe treatment method.
What is that all about?
Example like autoclaving. Yes, like your instrument.
Okay.
Yes. So when you use instrument, it's best you soak the instrument first. When you soak for some minutes, you wash them, rinse, then package and take it for autoclaving. This particular method will prevent anybody, like if this instrument has been used for somebody that is already infected already, autoclaving will help kill the bacteria that is on those instruments before you can use it for another person. So
now let me ask this while you're trying to go through all of that. Is there a body that tries to monitor practices in the hospitals to check if all of this is put in place or is done? Because what you're saying, if there's nobody to check what the practices that is going on, then it's left to the hospital management or the healthcare facility to just do whatever they can. This is the side of the hospital. We're going to come to what the patient need to do to protect themselves. But is there a body, is there a supervisor that goes around to check if this is done? Not minding whether it's a government hospital or a private hospital or a clinic somewhere in a remote area.
Yes, there is a body in Nigeria that checks out all this stuff.
So what do you think has been the outcome or the experiences from your practices? Not necessarily where you practice, but I mean generally.
Generally,
are there people who are cutting corners, who are not doing the best practice? Are people who are not doing what they're supposed to do?
You could say people living in the rural areas.
Oh.
Yes. But when you talk about hospitals in the cities, because they know that these particular people are close to them and they are easy to walk into their facilities, they train their staff very well, and everybody is up on their deck. But when you talk about the rural areas, it is difficult for these people. Most times they don't really go to the rural areas to check their waste disposal. But I think I think the rural area, they are also trying to as well, because you could not compare rural and urban area with the way things are. But anyhow, you could not give them 0%. You could say them too, they're also trying.
So they need to do more.
They need to do more, yes.
All right. The number to call to be part of the program. Let's have your experience, practices in the hospital, whether they are helping to promote, enhance, or get you well quicker or faster, or there are people who have an experience of getting worse even after going to hospital because of what the hospital environment.
Yes.
The number to call is 081 084 47518. 081 084 47518 is the number to call to be part of the program. All right. So what can the patients and the caregivers, usually people who accompany patients to the hospital, that is where for me the problem lies, and that's one of the essence where we have to have the discussion.
Yes.
What they need to do really.
Yes, as a caregiver.
Or what they need to be wary of.
Yes, as a caregiver or a patient relative, when coming to the hospital with your relative, one of the a role and responsibility you should be aware is that I'm coming to take care of my person, and I want my person to get better. So you should also be interested in what to do to help your person get better.
Yeah.
So one of the things we talk about is personal hygiene, which is very, very important. As much as the hospital is trying to maintain sanitation, if the rooms are clean and other things are clean, and whatsoever the patient is wearing or eating is not clean, the job is not being done completely. Because in situations where the patient already has a detailed food timetable that is being made by a particular chef, is understandable. But if this food is coming from the home, you should also be wary of the person making that food.
Yeah.
Is this person washing his or her hand before cooking? When this person, because there are situations where somebody might be cooking and might want to use the restroom. Yeah. After the restroom, did this person wash his or her hand before continuing the food? But if the person does not wash the hand, it's like taking bacteria from the toilet down to the food. He might not see the bacteria, but then he's introducing the bacteria into the food. When the food comes to the hospital, the patient is eating the food. The patient is not getting better. It's part of what is coming from outside. And then we also talk about the clothing too as well. We normally encourage light cotton clothing for patients that are in the hospital. Makes them feel better. When they have their beat in the morning, they wear these clothes and they are well groomed, they feel much, much better.
Yeah.
Yes. Another thing we talk about as a patient relative coming to the hospital too as well. As you are taking care of your person, you yourself, you should know you need to be around this person. Because the person can also get whatsoever virus or infection, disease you are carrying as well.
Yeah.
So most times whenever there is someone on admission, for somebody to fall sick, the immune system is a bit low.
Yeah.
So you also have to be on high standard of sanitation for you to be around that person. So as a patient relative, you should know when coming to the hospital, it's not the duty of the hospital and the nurses alone to make sure your family member gets better. It's also your duty to make sure things are on the spot too as well.
You mentioned the immune level, or they need to be up there when it comes to their immunity. Sometimes if they go through stress, trying to take care of the person who is sick, you really don't have comfort. In most hospitals, there are no comfortable place for the person who is taking care. And that is quite, like you said, you need the support and the collaboration of the relatives too. How would the relative be able to put themselves together in a hospital environment so that they are in good shape, not stressed?
Okay. In every hospital, we encourage you come with at least one relative.
Okay.
Yes, because the hospital is big.
All right, let's take this call. Okay. Hello.
Hello, good evening.
Hello, good evening. The name and where you're calling from?
My name is Gladys. I'm calling from Kubwa.
Okay, nice to have you. Is it raining in Cuba?
Oh, it's dripping. No, this person.
Okay, all right. Let's have your contribution.
Okay, my one is complaint. Like, I usually have my body usually used to sell part of my body. They used to sell it, then it go down by itself. Then it's giving me as it used to scratch me, sir. And it's to pain me to go down. The next day when I actually wake up, I will see this thing again. So I don't know, but people said I'm reacting to something, but I don't know what.
Okay, you are having some, your body is itching you.
It's itching again to swell up.
Okay.
Then to go down again. Maybe the next day I will see it again.
Okay.
Like my hands or my stomach or anything.
Okay, that's noted. I'll have Anifa react to that. Probably, I mean, you need to see a doctor. Basically, that's what you. And in the light of immunization we're talking about, probably that's what she's asking. Okay. I love that.
No problem, I could understand. Sometimes our body reacts to things one way or the other. There's a possibility you are reacting to a particular, either maybe soap or water. So the best thing I could advise is when you're trying to use your water, the water you're using, is it from a very neat source? That is one of it. If it's from a very neat source, you try to use antiseptics. Maybe something like Dettol for a while. So it will help to ease the pain and the itches and the swelling and all. And then your beddings, try to soak your beddings, wash them and sun dry your beds. That could help as well.
Yeah. And if you get worse, you need to go to
see your doctor.
See your doctor. Really, I mean, sometimes there are many things we overlook that actually can impact our health. Our clothing, how we wash them, how we dry them, yes, and all of that.
Because this particular weather we are now, we don't really have sun that much. Yes, like people that wash this morning now, before evening it's already raining.
Yeah.
So if you get this cloth and it's cold and you don't keep it in a place where if by tomorrow you can sun dry it again, you pack it and just keep it in a particular place. There are some bacteria that might form inside the clothes, and when you put it on, your body starts reacting to those bacteria.
So there are so many things to actually be concerned about, to be cautious of when we talk about issues of environmental health. So all of that is very, very important. All right, we're still talking about World Health Day and getting bits and tips of advice on how to live healthy, our hospital environment especially. In other edition of the program, we'll be talking about homes and sanitation, all of that, but we're trying to conclude our discussion on what we need to do to protect ourselves, and Nurse Hanifa was giving us all of that. Are there other things patients and the relative could do before we try to wrap up the program?
Yes. So we're talking about trying to, the patient relative, what to do to not overload themselves. We say we advise one relative. But then if a particular relative is in the hospital, it's stressful to stay in the hospital for a while. So that is why it's best we advise relatives come in and do shifts with their patients. So if there's a person with this person from morning at evening, there should be another person to come there and relieve that person. So the person can also go home, freshen up and come back. Yes. Because when you are refreshed, it is easy for you to nurse the person that is sick. But when you are tired, whatsoever that is happening there, you are easily irritated. Why? Because you're already tired and you want to rest. Your body is requesting for rest already. So if you're not getting that, you might end up falling sick as well.
Are there situations where the patient relative come to the hospital and is showing obvious signs, symptoms of illness, and the hospital have to deal with it? Or what's the response or reaction of the healthcare facility or the management?
Yes. For every patient relative that is in the hospital, if the patient relative falls sick, you are advisable to see a doctor if you are within the health facility. So for a patient relative I've seen a situation where a patient relative comes, maybe because of the person is alone for a very long time. You are alone, you have to go home, get food for this person, you have to do this and that. The person end up falling sick. So in that situation, when you are sick, there is nobody around the patient. You might make the patient too worried. So we are trying to make somebody get better. You, the relative, you're already sick as well.
Yeah.
So you are not helping us with making our patient get better. So when we see a patient relative that we feel is about to fall sick, we advise you go and see the doctor. And when it's something that you need to get medication, you get medication, and maybe we let you get somebody else to come stay with the patient.
They say the hospital environment has a lot of the air environment is really saturated with microorganisms. So it's not the best environment to be really. I compare that to residential facilities to other places. To a bar, for example, what would you say? Hospital environment or a bar which of these is most healthy?
I said the hospital environment.
Why? The argument is that the hospital environment has a lot of bacteria. People who already have delicate health condition.
Yes.
Other environments that you may consider are not too hygienic because of the lifestyle and all of that. But you have microbial organisms, you have probably smoke and stuffy situation in such an environment. So what's your argument for the hospital environment?
Okay, for hospital environment that are very stuffy, we for the smoke from the generators or which of it?
Yeah, it could be from any source.
Most of the gen we have right now does not really bring out smoke, and I think Abuja is doing better when it comes to electricity.
Are you sure about that? But talking about environment, are you sure about that?
I try. But when it comes to the environmental pollution, we know most times the generators generate smokes that are not comfortable. But then everybody trying to install a generator now try to fix the gen at a place where the air can go to a particular section without disturbing the patient. So it's advisable that whatsoever pollution that is happening around the hospital does not have anything to affect the patient. So we are putting that into consideration as well.
All right. Okay. A lot has been said on this World Health Day while we're still promoting World Immunization Week coming up. There's no need to be talking about World Immunization Week where we are right inside the week. It's best for us to talk about it now. We'll talk about free immunization taking place in Jabi at Trust Charitos Hospital. Please do go there and have yourself immunized. Get the best immunization and have yourself protected from vaccine preventable diseases. It's free of charge on this World Health Day. Encourage others to do the same thing. It's not just for children, but for adults as well. All possible vaccine against many of the public health diseases you can have the vaccination and be very, very well protected. All right, I want to thank sincerely Nurse Hanifa Abdullahi for coming to do this, shed light on all of this immunization week. And on this day, we celebrate or commemorate World Health Day for giving us all the tips. I hope our listeners have taken note of this and really seize the opportunity to get themselves vaccinated. Is there a way you keep record of the number of people responding to vaccination over time? What has been the feedback from your experience in the previous years, or what are you expecting? What are you expecting to get this year? The number of persons, based on creating this kind of awareness of what you've done previously.
So far, so good. The amount of people that take this vaccine has increased.
Yeah.
And feedback is about 98 to 99%.
Yeah.
So we've never had any side effects or any complaint, and we hope each year as the year goes by we can do more better when it comes to vaccination.
Yeah, if there's anything you've said today vaccination to children when they are giving birth to,
Yes.
but adults too
As well. You can come and get yourself vaccinated.
can get yourself vaccinated. I mean, that point is very, very important. All right. I want to thank all those who have tuned in to listen to the program, and call out from Jabi, no, from Cuba. Sorry for that. Please, the advice given, and if it persists, please see a doctor. I want to thank my producer, Martina, for helping us have a smooth session on the program. All right, when we come your way next week, we should close up to World Immunization Week and World Malaria Day. So there's a lot of days to celebrate about issues of health in this month of April. And thank you for coming on the program. Ms. Hanifa, nice to have you. Hope you're going to come again on Echo Care.
Just okay.
Yes, we come to Echo Care once and always come again. All right, until we come anyway next week with another edition of the program on the environment, Echo Care. Still remains Stephen. I'm your environmental health officer on radio. See you next week. God bless you and happy Easter.
You did well.
All right, well done, well done.
Second, Jeff, let me take a picture of you guys. Yeah, the form is filled up.
You stop recording.
Still recording. It's live. Alright, that's fine.